I'm Christian Johnson. We're on the air this Thursday with all the news that matters to Leeds. The headlines for the city tonight. Worldwide leaders, researchers at the University of Leeds, are conducting pioneering research into better diagnosis of cancer. But first to our top story, and a multi-million-pound project led by a team of researchers here in Leeds is looking at ways of better diagnosing and treating cancer at an earlier stage. The CanTest project is being funded by a £5 million Cancer Research UK grant, and we'll look at how GP surgeries may be able to carry out tests to diagnose some cancers which are typically difficult to identify, such as brain cancer and pancreatic cancer. It could ease the burden on hospitals, but there are fears that the workload might simply be shifted to GP surgeries instead. The battle to beat cancer is always evolving, with research constantly being undertaken to try and better understand the disease, which affects hundreds of thousands of people in the UK every single year. Leeds has long since been a major research centre within the UK, and a new worldwide project is being led by a team from the University of Leeds to see if more patients can be tested at their GP surgeries for certain types of cancer.
Many people with cancer are diagnosed very quickly, and GPs act brilliantly in their diagnosis. But there are some cancers some types of cancer that are much harder to diagnose, and these tend to be often the rarer cancers or cancers that don't give telltale symptoms. And examples of that are pancreatic cancer or a disease called myeloma, which is a cancer of certain cells in the blood. So we're going to try and focus on the so-called hard to diagnose cancers, but also on the commoner cancers where people don't always get the obvious symptoms. For example, not everybody with breast cancer gets a breast lump. So we'll also try and focus on tests that can help GPs in those kind of diagnoses.
The CanTest project has been handed a £5 million grant by Cancer Research UK, and Richard and his team will soon begin to conduct research together with their global partners.
It's great for Leeds and it's great for Yorkshire. I mean, Leeds has been a big centre for cancer research over many years, but it's also great that we've got international partners. We've got international partners in Europe, in Australia, and in the States. And they have different kind of health systems and have access to different kind of tests and different ways in which they use them. So what we have the opportunity to do would be to examine the differences in doing different tests in different health systems and seeing in which ways they work best.
If successful, the outcome could be that certain tests are no longer done in hospitals, easing the burden on specialists and potentially shortening the time frame between appointments. But there are fears that conducting tests at local surgeries will simply mean more work for GPs. Dr. Kirsty Baldwin works at Burley Park Medical Practice and also represents fellow doctors as a member of the Royal College of General Practitioners.
We fully appreciate, from a West Yorkshire healthcare point of view, that we need to move workload from secondary care into primary care, and probably from primary care into self-care as well. And early diagnostics and ability to perform good, effective, safe testing would be a great opportunity for us. But of course we need to make sure that we've got the workforce, should I say, in primary care to be able to deliver this testing, and it's pragmatic enough to be able to fit into our 10-minute consultations.
But Professor Richard Neal, who also works as a GP, has moved to allay these fears, saying only the relevant tests will be carried out at local surgeries.
Whilst we're all about investigating new tests and their effect of them, we're also about trying to make sure we do the right test for the right people, and not testing people that don't need testing, because that creates extra work for which there's no benefit. So it's about testing smarter and about testing more efficiently, and that's really central to what we're trying to do.
The project is still at an early stage, but the findings of this research could drastically influence cancer diagnosis across the world. On the air, I'm Christian Johnson.